1. Kansas faces budget crisis as federal spending bill threatens Medicaid and SNAP programs. 2. Kansas faces $4 billion Medicaid cut, impact on hospitals and rural communities. 3. Kansas Medicaid cuts, $3.897 billion loss threatens rural hospitals and families. 4. Kansas Medicaid cuts, what you need to know about rural hospital funding and coverage. 5. Trump's big bill crisis, how Kansas hospitals and Medicaid are at risk. Jerry Moran's role explained. 1. Kansas faces budget crisis as federal spending bill threatens Medicaid and SNAP programs. Imagine a scenario where federal policies directly impact the lives of thousands of your neighbors. That's precisely what's happening in Kansas right now. The U.S. House has passed H.R. 1, a bill outlining Donald Trump's domestic agenda, and it's stirring up a storm of controversy. But here's where it gets controversial. While some see it as a necessary reform, others view it as a harmful cutback. Let's dive into the details. In Wichita, Kansas, Governor Laura Kelly, a Democrat, has raised her voice against the bill. She believes that the proposed reductions to Medicaid and the Supplemental Nutrition Assistance Program, SNAP, will have severe repercussions for the state's budget and the people who depend on these vital programs. With Kansas already facing budget constraints, the state will find it challenging to fill the gaps left by federal funding cuts. We will have to adjust our SNAP and Medicaid programs to cope with the reduced revenues, Governor Kelly explained. This means a reduction in services and support for hospitals and healthcare providers. In simpler terms, fewer people will receive the help they need, and essential services will be scaled back. But not everyone sees it this way. Senate President Ty Masterson, a Republican, argues that the bill is not about cutting funds but about eliminating fraud and abuse within these programs. He believes this will ensure that the programs serve their intended beneficiaries, low-income individuals, the elderly, children, and the disabled, more effectively. The goal is to save the program for those who truly need it, Masterson stated. This perspective highlights a key point of contention. Is the bill a necessary reform to prevent misuse, or is it a harmful reduction in essential services? Democratic Representative Suzanne Weichel has also weighed in, urging Senators Jerry Moran and Roger Marshall not to support the bill. She warns that shifting costs to the state will create a significant budget problem for Kansas, one that the state was not prepared to handle. They are transferring costs to the state, which means Kansas will face a budget crisis, Weichel explained. And this is the part most people miss. This budget problem is more severe than we anticipated. Despite these warnings, Moran and Marshall, along with Representatives Ron Estes, Tracy Mann, and Derek Schmidt, all Republicans, voted in favor of the bill. Representative Sharice Davids, a Democrat, was the only member of the Kansas delegation to vote against it. As the dust settles, one thing is clear: changes are coming, and they will affect Kansas in ways that are still uncertain. Whether these changes will be beneficial or detrimental remains to be seen. But one thing is for sure, the debate is far from over. So, what do you think? Will these reforms strengthen the programs and protect those who need them most, or will they leave vulnerable Kansans without the support they rely on? Share your thoughts in the comments below and let's keep the conversation going. 2. Kansas faces $4 billion Medicaid cut, impact on hospitals and rural communities. Kansas is on the verge of losing nearly $4 billion in Medicaid funding, a situation that could leave thousands without health coverage, as highlighted in a recent report regarding the Senate-approved version of President Donald Trump's One Big Beautiful Bill Act. This alarming figure amounts to a staggering $3.897 billion in federal and state Medicaid funding that could be at risk. The implications of this bill are profound, particularly for Kansas hospitals, which are projected to face a loss of $2.65 billion in funding over the next decade. This significant reduction in financial support is expected to have dire consequences, with an estimated 13,000 Kansans likely to lose their Medicaid health insurance. Such a decline in coverage would not only increase the number of uninsured individuals but also exacerbate the financial difficulties faced by rural hospitals that are already struggling to remain operational. The Senate's proposed legislation includes over $1.2 trillion in cuts to Medicaid, factoring in both federal and state funding losses resulting from the changes made in the bill. While the Senate has proposed a $50 billion relief fund aimed at supporting rural hospitals, which would allocate approximately $811 million to Kansas hospitals, this amount falls significantly short of what is needed. As David Jordan, President and CEO of the United Methodist Health Ministry Fund, pointed out, we appreciate efforts to help our rural hospitals. However, it's not enough. Jordan emphasized that the relief provided is not a sustainable long-term solution. He warned that hospitals cannot absorb billions in Medicaid cuts without resorting to service reductions or even closing their doors. With rural communities aging and requiring more healthcare services in the future, the current measures do not adequately address the impending challenges. This analysis was conducted by Manet Health at the request of Kansas health philanthropies, including the United Methodist Health Ministry Fund and the Reach Healthcare Foundation. Medicaid, which is a public health insurance program, currently covers over 366,000 residents in Kansas, providing essential health insurance for low-income parents, children, seniors, and individuals with disabilities. The Senate's proposal is poised to have a particularly severe impact on rural areas, where a higher percentage of residents depend on Medicaid for their health insurance needs. Alarmingly, more than half of the rural hospitals in Kansas are already at risk of closure, according to the report. The findings indicate that Kansas hospitals could lose $1.608 billion in federal Medicaid funding over the next 10 years, coupled with an additional $1.042 billion in state Medicaid funding, culminating in a total loss of $2.65 billion. Currently, Kansas has the highest number of hospitals at risk of closure in the nation, with 63 rural hospitals facing potential shutdowns and 87% of these facilities operating at a financial loss. The existing federal funding is already insufficient for their survival, and the proposed bill would further jeopardize their ability to continue serving their communities. Brenda Sharp, President and CEO of the Reach Healthcare Foundation, expressed her concerns, stating, "This bill is a serious threat to the health and well-being of thousands of Kansans. Cutting Medicaid funding and SNAP would weaken the safety net that holds our communities together, especially in rural areas where healthcare options are already limited." She urged the House to carefully consider the long-term ramifications of this bill and to vote in favor of protecting the programs that are vital for sustaining communities. Jordan echoed this sentiment, warning that if these changes are enacted, the consequences for Kansas families could be devastating. In neighboring Missouri, where one-third of rural hospitals are also at risk of closure, the state is projected to experience a 29% reduction in total rural Medicaid hospital reimbursement. Furthermore, around 42,000 rural enrollees in Missouri are expected to lose their coverage as a result of these changes. Manet Health noted that these estimates may be conservative due to the lack of publicly available data. Additionally, the analysis did not account for how Kansas might respond to significant funding losses, nor could it model the coverage losses stemming from the bill's alterations to the Affordable Care Act's health insurance marketplace. However, it is clear that these changes will lead to even more Kansans losing their health insurance. 3. Kansas Medicaid cuts. $3.897 billion loss threatens rural hospitals and families. Imagine a scenario where a single legislative decision could unravel years of progress in healthcare access for thousands of people, and potentially devastate entire communities. That's exactly what's at stake in Kansas, where a new federal bill known as the One Big Beautiful Bill Act threatens to slash over $3.897 billion in Medicaid funding, leaving hospitals, patients, and rural towns in a financial crisis. But here's where it gets controversial. While the Senate claims to be addressing rural healthcare challenges, the proposed cuts might actually deepen the struggles of communities already teetering on the edge. Under the Senate-approved version of the bill, Kansas hospitals face a staggering $2.65 billion in funding losses over the next decade. This isn't just a number. It translates to 13,000 Kansans losing access to critical health insurance coverage, a move that could push rural hospitals closer to closure. With many of these facilities already operating at a loss, the financial strain could force them to cut services, lay off staff, or shut their doors entirely. And this is the part most people miss. The bill's Medicaid cuts are compounded by reductions to the Supplemental Nutrition Assistance Program, SNAP, which could further strain families trying to afford basic necessities. The Senate did include a $50 billion rural hospital relief fund, offering Kansas $811 million to offset some of the losses. However, as David Jordan, President and CEO of the United Methodist Health Ministry Fund, explains, this amount is a drop in the bucket. It's not a viable long-term solution, he says. Our hospitals can't absorb billions in Medicaid cuts without sacrificing care or closing. Rural communities are aging, and they'll need more healthcare, not less, in the coming years. The reality is, this relief fund barely scratches the surface of the problem. These alarming findings come from a detailed analysis conducted by Manat Health on behalf of two Kansas health organizations, the United Methodist Health Ministry Fund and Reach Healthcare Foundation. The study reveals that Medicaid, which covers over 366,000 Kansans, including low-income parents, children, seniors, and people with disabilities, faces a dual threat. Federal and state funding cuts, combined with changes to the Affordable Care Act's health insurance marketplace, could leave hundreds of thousands without coverage. For context, Kansas already has more hospitals at risk of closure than any other state, with 63 rural hospitals in danger and 87% of them operating in the red. Losing billions in Medicaid funding would make survival even harder for these institutions. The ripple effects of this crisis extend far beyond hospitals. When rural clinics close, jobs vanish, and access to care disappears, leaving communities without essential services. Brenda Sharp, President and CEO of Reach Healthcare Foundation, warns, this bill weakens the safety net that holds our communities together. In rural areas, where healthcare options are limited, these cuts could push us further from a future where everyone has the chance to thrive. Critics argue that the Senate's estimates underestimate the true impact of the bill. Manat Health's model relies on publicly available data, which doesn't account for how Kansas might respond to drastic funding losses. Without new state investments, the state may have to slash payments to providers, narrow eligibility for Medicaid, or reduce benefits, all of which would hurt vulnerable populations. Meanwhile, changes to the health insurance marketplace could leave even more Kansans uninsured, creating a perfect storm of healthcare access challenges. Jordan adds, this bill makes sweeping changes to programs that help Kansas families access healthcare and food. If approved, these changes will be devastating. The question remains, can the House of Representatives see beyond short-term political gains and prioritize the long-term well-being of Kansans? Or will they let this bill pass, risking the health of entire communities? We'd love to hear your thoughts in the comments below. What do you think is the right balance between fiscal responsibility and healthcare access? Is the current relief fund enough, or should states be required to invest more to protect rural hospitals? 4. Kansas Medicaid cuts. What you need to know about rural hospital funding and coverage. Bold statement to hook readers. Medicaid cuts could leave thousands of Kansans without vital healthcare coverage, yet some lawmakers seem unfazed by the potential consequences. The American Hospital Association, AHA, has issued a stark warning. Proposed Medicaid cuts could result in the loss of coverage for over 5,300 Kansans in the next decade. The recent Senate bill, which passed with nearly $1 trillion in Medicaid cuts, is the most significant reduction since the program's inception in the 1960s. But here's where it gets controversial. While the AHA projects a $50.4 billion reduction in federal Medicaid funding to rural hospitals in Kansas alone, Senator Roger Marshall remains optimistic. He believes the bill will actually protect rural hospitals by creating a $50 billion emergency fund. Marshall confidently told 27 News, in Kansas, "The only ones that's going to lose Medicaid or SNAP are people that are unwilling to work or volunteer for 20 hours a week, for the most part. If you have a disability, you're a senior, we are not going to touch you." But and this is the part most people miss, the AHA reports that 47% of births in the US and 65% of nursing home residents in rural communities are covered by Medicaid. This means that Marshall's assurances may not hold true for everyone, especially those in vulnerable communities. The AHA warns that nearly 12 million lower-income Americans could lose their health insurance by 2034, including 48% of rural hospitals that already operate at a financial loss. This raises the question, are we really prepared to gamble with the health and well-being of so many Americans? And this is where the controversy deepens. President Donald Trump, echoing Marshall's sentiments, has claimed that the bill cuts $1.7 trillion, and you're not going to feel any of it. But is this really the case? The AHA warns that nearly 12 million lower-income Americans could lose their health insurance by 2034, including 48% of rural hospitals that already operate at a financial loss. This raises the question, are we really prepared to gamble with the health and well-being of so many Americans? The Center for Healthcare Quality and Payment Reform, CHQPR, paints a different picture, highlighting that 703 rural hospitals across the nation are currently at risk of closure, with Kansas accounting for 8% of those at immediate risk. As the bill heads to the House, some moderate Republicans have expressed concerns about the impact on rural hospitals. Will their voices be heard, or will the bill push forward without adequate safeguards? What do you think? Should lawmakers prioritize budget cuts over the health of vulnerable communities? Share your thoughts in the comments below. 5. Trump's big bill crisis. How Kansas hospitals and Medicaid are at risk. Jerry Moran's role explained. In a move that could potentially devastate Kansas hospitals and Medicaid, U.S. Senator Jerry Moran, Republican Kansas, has voted in favor of a massive budget reconciliation package. This bill, which is making its way through Congress, is expected to remove thousands of Kansans from Medicaid and cost the state's hospitals billions of dollars. Despite these facts, Moran has chosen to support the bill. Moran released a statement after the Senate voted for President Donald Trump's One Big, Beautiful bill early Tuesday. However, what's striking about the senator's words is not what they say, but what they don't say. He doesn't deny that Kansas hospitals will face cuts. Instead, he says they won't face any immediate cuts, which is like saying you don't face an immediate risk of death from a train hurtling toward your stalled car on the tracks. The statement is filled with conditional language, such as Kansas being able to continue pursuing an application for increased payments, and certain providers receiving increased payments. However, it's important to note that the legislation includes a $50 billion fund for rural hospitals, which will be paid out over 5 years and available to all 50 states. Given that Kansas hospitals will experience a $2.65 billion drop over 10 years, basic math suggests that federal money won't go far enough. Most disappointingly, Moran makes no mention whatsoever of the 13,000 Kansans who will lose insurance coverage through this package. Indeed, he does not mention Medicaid recipients a single time in his statement. Real people's lives and communities are on the line here. Trump's administration has asked lawmakers to play reverse Robin Hood, snatching benefits from the poor to benefit the rich. All the carefully tailored language in the world won't change that.